Good afternoon, everyone, and good morning to our friends on the West Coast. My name is Drew Voitel, and I'm the Senior Associate for Education and Outreach at CAQH CORE, and it is my pleasure to welcome you today to our Town Hall webinar. Before we begin, I would like to briefly mention a few logistical items. You can download a copy of today's presentation from our website using the web address shown here in the top bullet. A link to the PDF version of the presentation can be found under the listing for today's webinar. Also, a copy of the slides and the webinar recording will be emailed to all attendees and registrants in the next 1 to 2 business days. We will have time at the end of today's program to respond to audience questions. You are encouraged to submit your questions at any time throughout the webinar by typing them into the questions panel on your webinar dashboard. We do ask that when you submit your question, though, to please identify the type of organization you are with so that we can give you a more applicable response. Today we'll be discussing the full complement of initiatives and activities within CAQH CORE. You can see our session today is outlined around CAQH CORE's work on industry-driven initiatives, our drive toward industry adoption, our commitment to and maintenance of our HHS designated activities, as well as new and future plans. Also, please know that we will have opportunities for audience participation in the form of 2 polling questions during these presentations. And again, we will take questions at the end of the program. So now I would like to introduce our first speakers, CAQH CORE Managing Director Gwen Lowe's and CAQH CORE Associate Directors Aaron Weber and Robert Bowman. Gwen, we'll start with you.
Good afternoon, everyone, and thank you for joining us. It's an incredibly interesting time within our industry, and so we're looking forward to sharing with you this afternoon what we'll be focused on as an organization throughout 2017, understanding things will evolve throughout the year as we work with the new administration. As you think about CORE, when CORE started, we were a voluntary initiative, and we've always done things that are voluntary, as well as then became an HHS designated author. So those 2 roles still continue, and we are completely committed to both of those roles. And within those roles, we're always focused on return on investment, value, and industry need. And more and more data is getting exchanged electronically, so that need and that value just continues. So it's going to be a big year for CORE as we're moving forward into 2017 to do both of these roles, the voluntary and the designation. So with that said, there'll be 3 areas we're going to go over today. One is some of the voluntary industry-driven efforts that we are working on as an organization, with many of the CORE participants really driving the effort. Then also all the HHS designated maintenance activities. This is required under regulation, and we're continuing to move forward, and these maintenance activities are essential to the billions of payments, remittance advice that get passed every single day in our industry. And then we'll also talk through whether it's voluntary or it's HHS maintenance. CORE has always had a model where it's the development of the rules, but not then just the development in a multi-stakeholder setting. It's also the adoption and driving that adoption throughout the industry, and then tracking the progress of that adoption. So we are going to talk about the voluntary CORE certification program, where that is, and some new tracking mechanisms that have been set up, spearheaded by the CORE board, to see the impact of the CORE certification. And we have noted in several places where the CORE participants have several places for input. So if you're not a member of CORE, please think about joining. We are with a lot of activities going on, and we need as much input as possible. We do go out in many times to get public input, but getting involved in the daily operations is the best way to go. So what are we talking about with value and impact and need? I think some of you are aware that every year CAQH does a study called the CAQH Index. The 2006 study came out in December, and just for these transactions that you see here, these 7 transactions, there's over 9.4 billion savings for the manual, moving from manual to electronic. And these are just labor savings. And you can see there's a value to both the provider and the health plan. So as we think about value and impact, it's not only labor, but it's all the indirect cost savings for time, so we can be focused on patient care delivery, we can be focused on quality of care. If you haven't had a chance to look at that index, please do. It's very valuable, and you'll be seeing more work like that from CORE coming out about return on investment for both the health plans and the providers. And when we think about return on investment and value, and where CORE is focused, this is just a highlight of some of the things that exist already with the CORE rules, and you're going to be hearing about this. With eligibility and claim status, we have made, obviously, progress, and you can see in the CAQH index what the adoption levels are for electronic eligibility and claim status. The work is far from done at all, and we really need to continue to get more health plans involved. We have more work to do to get the practice management systems involved, and they're non-HIPAA covered entities, so for some of them it's a voluntary effort. And then potentially additional rules that add more value to the industry so we do not have to do any manual. For prior authorization and attachments, you're going to hear later today about some of the work that's already set with the CORE Phase 4 rule, and then some of the work that will be happening with the attachments moving forward and the addition of new areas for opportunity with prior auth, which is obviously a hot topic, and there's a lot of overlap between prior authorization and attachments because in many instances both of them have the concept of sending additional documentation electronically. And how do we do that so it's no longer paper-based? I think we all know all that additional documentation that's required for both the prior auth and any of the attachment needs, it's primarily all paper. So how do we make that electronic? And then EFT and ERA, again, the index has shown, and we all know, we've got some fantastic progress, but we have to do more, and we especially need to continue to engage the non-HIPAA covered entities for the practice management systems and ensure that both public and private health plans are offering out all the requirements that the industry has agreed upon. So as we sit back for the year, we as an industry, how do we lead as an industry? Pick the things that are most essential, adding the most value, and then continuing to work with the government on the items that are mandated. And we're excited for the year to look forward and think about where is the industry going to lead the most and how do we want to make that happen. So with that said, a few minutes to talk about value-based payments. I think we all know that we're moving from a fee-for-service world to a value-based payments world. And that is going to continue on no matter what happens with regulations. There's many entities out there in the marketplace that have value-based programs or rolling them out, and they're going to continue to have them. And that goes from small health plans to large health plans to Medicaid on a state basis, and also provider-owned health plans. So we have spent quite a lot of time over the last year looking at where can we as an industry collaborate on value-based payment data exchange on all the operational needs, like the progress that has been made for fee-for-service. And you think about fee-for-service, it took a long time for us as an industry to decide what do we compete on and what do we collaborate on. So what we've done over the last several months is studied a lot of the secondary research that is out and published on value-based. We've interviewed several entities that are all executing value-based programs. We put out an interim report to the CORE participants and received feedback on that, and then we're going to be seeing a final report out to the public and then determining what are appropriate things for CORE to do and what are things that really others in the industry should be doing, because this is by far not all things that CORE should be doing, but where do we need to work with others, what else is needed, where do we want to call upon other organizations to add that value to make the operation smooth as we roll out for value-based. And so you can see some of the timeline there. I want to just share some of the detail on the value-based. If you think about the next slide, the background of the interim report, and again, if you're a CORE participant, you receive this report, and thank you for those entities that participated in the feedback. There was over 40 entities, all of which were implementers. There were 7 areas that were proposed for areas for action, and you can see those on the right. And within each of those 7 areas, there was detail given on actual items that could be pursued. So common data sets, for instance, could be where is the provider and the location and which contractor they involved in a value-based, because more and more in value-based, we've got to get down to the specific data, including which provider is providing which service at what location. So things like infrastructure rules, we heard loud and clear that access to claims data at the right time is essential to manage the value-based payments. So a lot of detail in the interim report behind each of these 7 areas. And then what was also given was barriers to all of them, like EHR interoperability. So what was done then, and you'll see on the next slide, there were 4 survey questions on the interim report, and then the findings are on the right. And we've now contacted those entities that were supportive or those entities that were not supportive to get their feedback, integrated it more, conducting more interviews, and when we'll be moving ahead to get this final report out. And again, these are the operational needs. And you'll see one of the questions here was, are you experiencing or anticipating new or different uses for the HIPAA transactions? And those transactions consist of the standards, the operating rules, and other things like the identifiers due to value-based payments, or do we need new transactions? And it was a half and half. So the other areas were really more of in the 70%. That area, half and half. We've got a lot of work to do as an industry to figure out how do we evolve these transactions as we move into this new world of fee-for-service for value-based, and how do we do that together as an industry. So we're looking forward to working with more of you on this, and I am going to hand it over to Erin, who is going to talk about, we've already rolled out an initial part within prior auth, phase 4, and she's going to talk about how that fits in with some additional activities. So thank you to everyone for coming on today's call, and we do hope you ask questions at the end.
Thanks, Gwen. As Gwen mentioned, I am going to talk about some of our new prior authorization efforts, but first I want to remind folks that this really is a 2-stage effort for CORE at this point. According to the 2016 index data, the industry adoption of the 278 prior authorization transaction is right around 18%. That was an increase from the previous year, but significant opportunities exist to increase electronic prior authorization, and that is the goal of the work CAQH CORE is undertaking. So stage 1 of prior auth within CORE is well underway. There is a phase 4 infrastructure rule for the 278 transaction, which establishes a lot of those foundational requirements that you may be familiar with our other operating rules, such as connectivity and response time. Stage 2, which is now in process, is looking at additional opportunities to increase electronic prior authorization and referrals. We have formed a small multi-stakeholder advisory group to guide a 4-part environmental scan that is underway to identify these additional opportunities and what may be realistic for the industry at this time. Next slide. The work effort has been occurring since late summer and will probably go through Q2 of this year. The advisory group reviewed an initial list of draft prior authorization opportunities, which may or may not be operating rules, because things like workflows and utilities are also included on this list. And through survey and discussion, the advisory group has refined that list and put it forward to a core participant survey, which just occurred over the last few weeks. The advisory group will continue to guide the environmental scan over the next month or so to vet and revise the draft opportunities list for further consideration by a future full core subgroup. And we will have a webinar outlining the results of that environmental scan later this spring. Next slide. Specifically, there are 4 components to the environmental scan. The first is the participant survey that I just mentioned. That survey closed at the end of January and included 14 potential opportunity areas for consideration. In addition to that survey, the advisory group is conducting stakeholder interviews to understand what are the key challenges and dig into more detail than you can get in the survey. There is a vendor product assessment underway to understand what are the vendors offering in this space. And finally, site visits are being conducted to providers to identify the processes and the workflows that are currently occurring and what challenges and barriers may need to be addressed at that component. There's a lot of effort going on in the industry related to prior authorization, and the work that CAQH is doing is really complementary to the other efforts, and we'll consider any findings from the other industry groups as well. Next slide. I'm going to give you a very early sneak peek into the core participant survey results. The advisory group has not even seen these results yet, but we did receive more than 75 responses from core participating organizations, which is well over a majority of the core participants, who spent time to rate 5 categories of 14 potential operating rule opportunity areas, specifically data content, workflow, formats, transport, and utilities. And the pie chart here gives you a breakdown of the respondent types. We had a healthy mix of stakeholders. Next slide. You can see a very high-level results of the overall categories here. Formats, data content, and transport really bubbled to the top of the opportunities, with utilities kind of falling off to the bottom. What was interesting is that within each of these categories, there were more detailed opportunity areas, and the support for those detailed opportunity areas is a bit more variable depending on the topic. While the overall categories provide some insight, we look forward to sharing more details during the webinar and during the launch of the subgroup on the specific opportunities that will be considered. Next slide. I believe with that, I'm going to turn it over to my colleague Bob Moman to talk a little bit about the work we're doing with attachments. Bob?
Great, thanks, Erin. And you're right. One of the kind of things that bubble up through any discussion with prior authorizations and referrals, and claims for that matter, is attachments. Attachments is kind of a gaping hole in the industry right now because so many people are doing so many different things. And what we have done, actually for the last few years, have been doing extensive research and outreach to all the different stakeholder types, from listening sessions to surveys, to ensure that we can really understand the needs of the industry and the different options for that incremental phased approach that we'd like to adhere to when addressing these types of issues in the industry. We are continuing to monitor the various industry initiatives, all related to attachments, and this includes working closely with HL7, X12, WEDI, and CPDP. The list goes on. But we're definitely part of that industry awareness to make sure that we understand what is going on. Part of that also is tracking any developments related to the NCHS recommendations on a set of implementable attachment standards. And part of that awareness we also are working towards industry leadership on is we partner recently with Lantana Consulting Group to set up a series of webinars specific to attachments. And our first one is actually next month in just a couple of weeks on March 2nd. It's part one, it's laying the foundation of electronic healthcare attachments, where we will discuss the basic standards that are being used in attachments today in the industry, provide an update on our initiatives related to attachments, Also make sure that we can understand the business drivers, the ROI, and the business case for claims and prior authorization. How do attachments impact these transactions, and then impact how providers send, submit, store this information, and can get it to the health plans for claims adjudication, for referrals, for prior authorization. So that webinar is coming up next month, early next month, and we already have the registration link available. So feel free to go ahead and register for that webinar now. With that, I'll go ahead and hand the call over to Drew for our first polling question.
Great, thank you so much, Bob. And this brings us to our first of two webinar polls that we have for our audience today. And the way this will work is I'll read and show you the poll here, and then what you will see is the polling question appear on your screen where you'll be able to answer directly from there. So this question asks, where have you encountered a business need for value-based payment that would most benefit your organization? And so in just a moment, you will see the poll appear on your computer screen. Go ahead and select the option, and in just about 20 seconds or so, I'll share the results for everyone to view. So take just a few seconds, and we'll take a look at the results. Take about 2 more seconds and we'll share the results. And Bob and Gwen, I'll have you comment here. All right, so I'll close the poll and share the results. And so we see 39% indicate that common data sets and definitions would be a benefit, followed by 24% definitions or standardization of specific terms, 20% saying other data to improve analytics, followed by 16% patient risk stratification. Gwen or Bob, what do these results mean to you?
I've been on a lot of the interviews with the implementers of the value-based programs, and I think it's representative of there's a need for all of these things, and some are understood or needed more depending on the stakeholder type, and also depending on the type of value-based program or alternative payment model they're using. So if it's a bundled payment, whatever type it may be, they may be more aware of a certain need. So this is very useful. If there is any of the folks that that commented here that you are running a program and you see a gap, please do email us at core@CAQH, because we would love to put you in that interview list, get information that we could include into the final report, which will go out for public comment. So please do follow up. It's an exciting time for our industry because we've got we've made so much progress in coming together on these transactions and data sharing and EHR interoperability, and now we're taking ourselves to a whole other level of patient-specific detail, so collaboration will become even more essential. Bob, any other thoughts?
I completely agree. I think that the collaboration and consensus that we can help drive can help really define some of the important metrics that we need as an industry to move forward with this initiative.
Absolutely. And Bob, we'll throw it back to you for this next section.
Great, thanks, Drew. And I think that in this section, we just want to provide you with an update and an overview of not only where we are with the operating rules, but also with core certification and some of our new learning modules that we have recently published and updated as well. So here for the quick overview on the operating rules. As you know, HHS Designated Operating Rule Author, that's our role that we're performing in the industry. We have completed phases 1, 2, 3, and now phase 4 with 1 through 3 focused on eligibility, claim status, EFT, and ERA transactions, all of which have been out in the industry now for three or more years. Most recently with phase 4, we've tackled the operating rules specifically for infrastructure for the 3 types of claims, the professional, institutional, and dental claim types, as well as the referral certification authorization, or the 278, the enrollment, disenrollment and health plan, and the health plan premium payment transactions. All of those now have sets of operating rules for the infrastructure, and they are for voluntary implementation at this time. Moving into the next slide, you'll see that the industry, not only have we developed the operating rules for the HIPAA mandated transactions, we've also implemented and developed a core certification program. And it really has become the gold standard for entities to ensure that they're in conformance with the requirements for the operating rules. The core participants developed the requirements. They met through lots of discussion, through polling processes to develop those sets of requirements. It does require conformance testing for the transactions through a third-party testing vendor who are experts in EDI and testing. And the role that CAQH CORE plays in that process is really as a neutral, non-commercial administrator. We just administer really the paper process behind the scenes, whereas the third-party vendor conducts all the transactions and all the testing and the uploads and downloads that you may have to do as a testing entity. Moving on to the next slide, we're happy to announce that the Phase 4 core certification is now open for beta testing, and we'll be launching that formally later this quarter, hopefully next month, if not a little bit sooner. But we do want to let you know that Phase 4 is now available. Entities are currently testing on the site for Phase 4 for those transactions, again, for claims and prior authorization and the 820 transaction, for example. All of those transactions can be tested today, right now. So what this really allows you to do, jumping on board and doing it early, is allow you to establish yourself as a leader in the industry, as an early adopter. Again, it helps really drive more value because you've already put in so much energy, blood, sweat, and tears in your infrastructure for the other transactions. And now you can mimic that for your claims transactions, for example, or for your prior authorization transactions. It does publicly demonstrate commitment to admin SIMP by signing that core pledge, by having your logo placed on our core certified website. It really kind of shines a beacon of light that you're part of that process. And again, it does show that you've been working towards and building upon the work that you've done in the previous stages. Moving on to the next slide, we are also very happy to announce that we have really reached a threshold here. We've hit 301 certification seals have been issued by CAQH CORE. And most recently, Aetna, GE Healthcare, and Rocky Mountain Health Plan achieved certification over the last couple of weeks. So we can, we're very excited about this number. It is a great milestone for us to have achieved over 300 certifications throughout the industry. Moving on to the next slide, we want to let you know that we do have a new core certification application portal. So no more clicking on hyperlinks to download a PDF to print out just to scan and email or fax back to us. We now have a process where entities going through the certification process can set up a profile, complete all of the required documentation, which does include the pledge, the HIPAA attestation, the seal application, and even paying the certification fee can all be done online in one portal, and it also allows entities to check the status of that documentation as it goes through the process, from initiating it to electronically signing the document, to validating the signature, to paying the core seal fee. All of that is tracked, and the status is right here on screen for anyone. So if you do have more questions about this, we do have a new application portal all available for you, and a learning module that helps you walk through that process and the steps of using the portal as well. So hopefully you will not have to search on the website for these forms. You do everything through that certification portal all at one time. Moving on to the next slide, continuing on the idea of our learning education modules, not only do we have the new one for the application portal, we also have one set up now for the voluntary core certification process itself. So if you can go through the learning module, and it walks through the 4 different steps of basic components of voluntary core certification, walks you through these sub-steps for that, so you can understand everything out of soup to nuts in one quick, easy module. We do have, as I mentioned before, an application portal module as well as one that we're also very proud of, and something that has really been great to know and be part of, is that we've developed an interactive map for the Medicaid entities that have completed and achieved voluntary core certification. And really in the last couple of years, we've seen a groundswell and a really momentum behind states pursuing voluntary core certification. As you see there, even as small as a picture as it is, a majority of the states have now completed certification either through phase 1, 2, or 3 to date. So that's very exciting as well. Moving on to the next slide, we do want to make sure that we track our progress, and this is something exciting that our core board wants to make sure that we do, and as part of the industry, to make sure that we can go back and report back to the industry some of the important details and facts and some of the coverage that a core certification now has. So we've dedicated a brand new web page to report on that market research that the operating rules and voluntary core certification actually is all about. So we had taken very specific measures to capture that what the rules do, what the certification systems, what the certification seals cover. This goes back to the plans that have completed certification, the health systems, the vendors, what providers have completed it. So it's really on both sides, both from the health plans and from the providers and the intermediaries in between, what that full impact really is. And right now we're happy to say that the high-level findings include that 64% of all insured lives in the U.S. are covered by a certified health plan for phases 1 and 2. So almost 2/3 of all covered lives are impacted by core certification. Health plans and their trading partners are experiencing the efficiencies, enabling them to save time, money, and evolve workflows. So things are changing. They can dedicate resources in other areas where it may need it. They can improve workflows and change things in a way that makes the business more efficient. The work to be done with health plan market share, especially in phase 3, we know that phase 3 is lagging because it is the most recent phase that's been out completely, and the certification has been available for a couple of years now. So we're working really closely with the health plans and with the vendors to ensure that they can see the benefits of pursuing voluntary phase 3 certification. So there's definitely more to come there and more work for us to do as well as the industry. There are 2 reports. One is specific for health plans and one is specific for providers. And it gives the background information from these high-level findings and goes into much more detail. So if you're interested in those, if you're interested in those reports, those are also available on our website. And with that, I'll hand the call back over to Drew for our second polling question. Drew?
Thank you, Bob. And this brings us to our second and final polling question of the webinar. And just like last time, I'll read the question, and then on your screen you'll see the poll appear for your response. So this question asks, does your organization plan to pursue voluntary core certification in 2017 for any of the core phases, 1, 2, 3, or 4? And so you'll see the question appear on your screen. Take just a few seconds, a few moments to log your response, and we'll share the results with everyone. And Bob might just get a quick comment, and then we'll move on. Take about 2 more seconds, and I'll share the results here. All right, I'll close the poll and take a look at what we got here. So majority unsure, 44%, followed by 22% saying no, 20% saying yes, and 9% saying not applicable or already certified. And Jessica, you have a comment?
Yeah. Hi, this is Jessica Porras, Senior Manager for Education and Outreach, and I wanted to speak to those of you who were in that 44%. I wanted to let you know we do have an upcoming webinar on core certification with Texas Medicaid scheduled for March 30th. So if you just want some basic information about voluntary core certification, come to our website and register.
Great. Thank you very much. And now, to discuss CAQH CORE's HHS designated maintenance activities is CAQH CORE Project Manager, Omni Adekambi, and CAQH CORE Associate Director, Aaron Weber. Omni, we'll start with you. Go ahead.
Great, thanks, Drew. And we'll begin with an update on CORE's activity to address ongoing maintenance of the core code combinations, which provide standard information about the reason for claim payment denials or adjustments. Next slide, please. The core code combinations build upon and combine 3 standard code sets that are published and maintained external to CAQH CORE. The Claim Adjustment Reason Codes, or CARCs, which provide the reasons for positive or negative financial adjustments to a claim. This code set is maintained by ASCX 12. The second code set is the Remittance Advice Remark Codes, or RARCs, which are used in association with a CARC to provide supplemental information about why a claim or service line has not been paid in full. And this code set is maintained by CMS Medicare. And finally, the Claim Adjustment Group Codes, or TAGs, provide information on which party is financially liable for the non-paid amount. And this code set is published within the ASC X12 technical standard. As shown on the next slide, the industry determined that a set of standard combinations of CARCs, RARCs, and group codes was needed to bring uniformity and standardization to these codes. Prior to the core code combinations, there were hundreds of thousands of potential code combinations that were being used inconsistently across plans, resulting in a lot of pain and confusion for the industry. To ensure the core code combinations remain compliant with the standard code list and address market needs, the code combinations are maintained on a year-round basis by the multi-stakeholder Core Code Combinations Task Group. The task group conducts 2 types of review of the core code combinations. First, compliance-based reviews occur 3 times per year and only consider changes applied to the published CARC and RARC list by the code committees. Compliance-based reviews are triggered when the current published CARC and RARC lists are updated, which occurs 3 times per year in March, July, and November. An updated version of the core code combinations is then published 3 months after publication of the standard codes list. Second, market-based reviews occur once a year and consider just industry submissions for improvements to the core code combinations to reflect industry usage and address evolving business needs. Per the established task group review cycle, market-based reviews always occur concurrent with the March compliance-based review, and any task group approved market-based adjustments are included in the June version of the core code combination. As the following slide outlines, there is a significant business drive to create and maintain the core code combinations, as managing denials is incredibly resource intensive. This is true for all stakeholders, but especially providers. Industry analysis suggests that 5 to 10% of all claims are denied, and this rate is usually much higher for very specialized claims. Additionally, claim denials for providers can eat up to 5% of provider revenue. It is important to recognize, however, that the overwhelming majority of these denials are preventable, and almost 70% of denials are recoverable. The core code combinations are important, therefore, because they help providers not just to understand and potentially correct existing denials, but improved messaging about why denials are occurring helps providers to prevent these denials from recurring in the future. Moving on to slide 36. An important part of ensuring that the industry is obtaining the benefits of the core code combinations is making sure the combinations reflect current industry business needs. As was referenced earlier, each year an industry survey is conducted to solicit suggestions for potential adjustments to the code combinations. To date, the industry survey has been conducted 4 times. The most recent survey opened in November 2016 and closed at the end of January of this year. The results of the 2016 survey provide strong evidence that the core code combinations are already meeting industry needs. While it was expected that the number of submissions would decrease over time as the code combination stabilized, the number of 2016 submissions reflects almost a 70% decrease since 2015, with only 7 potential adjustments received. This low rate of submissions suggests that many of the early challenges with the code combinations have been addressed through the periodic industry review of the code combinations. The low number of 2016 submissions is also notable given an extensive outreach campaign was conducted during the submission period that included webinars, emails, social media, and individual calls with entities. Some of the entities that we spoke with especially noted that they would not be submitting a response because the core code combinations are already meeting their business needs and no additional adjustments are currently needed. This said, CAQH CORE remains committed to evolving the industry survey to ensure that we are continuing to capture all industry needs. Additionally, we are currently conducting an impact survey of the maintenance task group participants to ensure that there are no unmet needs or gaps. And with that, I will now hand the call over to Erin Richter-Weber again, provide an update on the maintenance associated with the EFT ERA enrollment data sets. Erin?
Thanks, Omni. And for those following along, I'm now on slide 38. Similar to the core code combinations, there are two phase 3 EFT and ERA operating rules that also have maintenance in them, and that is the EFT and ERA enrollment data rules. These rules specify a set of data elements required to be collected when a provider enrolls in EFT and ERA. When the rule was developed, the core participants recognized that business needs may change or evolve over time, and thus the data sets may need updating. So the rules require that the data sets be reviewed on an annual basis. A task group was established several years ago and laid out policies around the reviews. And so there are two types of annual reviews. One is a comprehensive review, and this addresses both substantive and non-substantive adjustments. So if a substantive adjustment is approved, HIPAA-covered entities would need to update their enrollment forms and systems. During off years, there are limited reviews which address only non-substantive adjustments, which might be needed to clean up the data sets, make the information more clear. This fall of 2017, there is a comprehensive review scheduled of the enrollment data set. So that will consider both substantive and non-substantive adjustments. We will be sending out a call for submissions in the fall, and then the task group, which maintains the data sets, will review those submissions. And if any are approved, there is a timeline set forth by the task group in terms of how long entities have to update their enrollment forms and systems. And we do have a web page dedicated to this process if you're looking for more information. And if you're looking to get very involved in the review process, I would encourage you to join the task group as a core participating organization. Lots of opportunity to have direct input there. On the next slide, I just want to very quickly touch on some of the other work we're doing related to our role as the HHS designated operating role authoring entity, and that is continuing to follow and track federal advisory efforts, and specifically the National Committee on Vital and Health Statistics and the ACA Review Committee. The NCVHS full committee last met in actually November of this past year, and then the next full committee meeting is in February. So there are a number of topics that the group is looking at. In particular, some of the key areas of focus are around data on the adoption of HIPAA transactions and operating rules. The ACA Review Committee is looking at having hearings on prior authorization and Section 10109. And finally, there is discussion of working on a roadmap to outline future updates to the HIPAA standards and operating rules and what that process might look like. So I believe there is discussion of a work group being held in August. All of this is subject to change based on the preliminary agenda and goals set forth by the NCVHS in November. Next slide, please.
Great.
Now I'll turn it over to Bob to talk a little.
Yep. I was going to just say thank you, Erin, and now we'll pass it on to Bob for our CAQH CORE's activities related to 7030. Bob, go ahead.
Great. As the industry, as you may or may not know, the industry is moving forward with reviewing the version 7030 TR3s, because X12 has published those really on a staggered basis for public review. And CAQH CORE is also taking a role in this review as well. But that role is part of our existing strategic drivers and guiding principles as CORE, as Gwen and Aaron mentioned, as a role of the HHS designated operating role authoring entity that has a specific role for us through that, for being that entity. So we do have specific requirements that we need to ensure that the operating rules don't repeat or duplicate or in conflict with the requirement of a standard, for example. We have this strategic stance to ensure that any existing data content requirements in the operating rules get rolled up into the next version of the standards. So that's part of this review cycle for CAQH CORE. We're also committed to ensure that the maintenance processes are thorough, represent diverse stakeholder types, they capture real-world usage data. That's what we ensure for ourselves. We make sure that that's also part of the process as we move forward as well. So obviously building on lessons learned, what we've been through for the last 10 years, the value that the industry has seen in the operating rules as an augment to the standards, as a supplement. The improved efficiencies are gained, the ROI for the industry is going to be very important for us, as well as making sure that we can balance the data exchange needs for fee-for-service and the evolving payment models, because those are evolving faster than the standards are. So we want to make sure that what we find through our research and analysis and through the different initiatives that CORE has, that we can help inform the review of the 7030 TR3s. So if you go to the next page, just a couple of things that we're doing for the review. We're going to focus on three main areas: the value for adopting the new version, data content, obviously, and maintenance processes. These are going to be really important for us. As I mentioned, business drivers, moving the industry from one version to the next takes a lot of time, energy, effort, and money. We saw this a couple years ago when we went from 4010 to 5010. So make sure that using the integrated model that CORE has, what that really means, what the impact is for the industry, what does it mean for the impact for the stakeholders. Again, we're trying to build efficiencies, trying to evolve the business needs for health plans and providers, as well as the intermediaries in between. So we want to drive that value. We're definitely going to review data content. As you know, data content is really important for us, specifically for phase 1 and 2 CORE rules for the eligibility transaction. So we'll review that TR3 when it is published. We will also continue to review any sort of references to maintenance, what those maintenance processes are, because we know what the effort is and what it takes. From our perspective, looking at the core code combinations, and as Aaron just mentioned, the enrollment data sets for the EFT and ERA, that's also a review cycle that we go through. So those are some of the steps that we're going to focus on for our review for the 7030 TR3, specifically for the eligibility transaction, which we don't know the exact date I think it's going to move, but it was originally set for March 1st. So there is going to be some change to that schedule that will be published on the X12 website, but we want to let you know that we are reviewing the TR3s. We're part of that process, and if you have any questions, feel free to reach out to us and let us know. And with that, I'll hand the call over back to Aaron for our summary and Q&A.
Great, thanks, Bob. If you take nothing else away from today's call, I think that we can all agree that it's going to be a very busy year, both within CAQH CORE and across the industry. We have multiple work streams going, as you can see from this slide, from the value-based payments work and the prior authorization work, all the way down to the 7030 analysis that Bob just mentioned. Throughout it all, we will be continuing to drive adoption through the phase 1 through 4 core certification process and tracking implementation and reporting progress. We would really encourage you all to get involved, and there are different ways and different levels with which you can get involved with CORE, but the #1 way to get involved is by becoming a CORE participant organization. This gives you exclusive access to participate in our task groups that are doing the maintenance, and our subgroups that are doing the rule development, and provide feedback in our surveys and feedback initiatives on various topics. Certainly, we would also encourage those that aren't able to join at this time to continue to attend our ongoing webinars, particularly related to the attachment series, and also our regular town halls like today, where you'll receive these updates on the work that is being done. Next slide. Everything, the industry is changing, and part of our mission is to drive the creation and adoption of new healthcare operating rules in response to the changing industry. So we will be tracking and looking for your feedback on where the opportunities are. So we encourage you to stay engaged through CORE participation. And with that, I think it's time we open up for questions.
Great. Thank you so much, Erin. And so now we have some time for questions from the group. And so please submit your questions by typing them into the questions panel on your dashboard and identify the type of organization you're with so we can give you a more accurate response. And so I'm going to turn this portion of the presentation to my colleague, Education and Outreach Senior Manager, Jessica Porras.
Thank you, Drew. So we have gotten several questions on a couple of topics, so I'm going to try to paraphrase them. The first question is, probably was waking us all in the morning excited to read the newspaper, and it's, what is the effect of the new administration on administrative simplification and potential repeal of the ACA? I'm going to turn this over to Gwen to answer.
Great, thanks, Jessica. And this is on everyone's mind. It's kind of unavoidable, right, not to be thinking about it. So two things. One is the CORE board, again, it's multi-stakeholder executives, have made it a goal for themselves this year to go through some scenario planning. So looking at all different scenarios and how we as CAQH CORE would move forward. So that process is underway. And then when the time comes, should the aspects of the ACA that impact the operating rules, there's a dialogue, we'll be jumping into that when the time comes. Obviously everything, and we go back to the beginning part of the presentation, it's all about industry need, return, and value. And CORE did start out as voluntary, and there's entities around this table. I mean, you have 300 plus certifications, all the Medicaids, that's voluntary. They don't need to do that, but they're seeing the value. And so we go back of, no doubt there's a role for the regulations, but there's also a role for industry leadership. And so considering both of those. So beyond the scenario planning, we're also have retained a policy shop that will be helping us maneuver through both the changes that may happen on a legislative and regulated basis and the new leadership. So more to come, and look forward to talking about that more, because it is a fast-moving target over a long period of time, however.
Thank you, Gwen. So the next question is for Bob. Hey, Bob, we got a question on safe harbor, and the question is there a safe harbor component to the operating rules having to do with data format, or is it just related to connectivity?
That's a good question. The safe harbor is specific to connectivity, where it allows for connectivity, a general broad level of HTTPS, MIME, or SOAP for phases 1, 2, and 3, basically, for entities to be able to submit and conduct the transactions. So it allows for that one single entry way for the transactions to come in or go out, depending upon the actual transactions themselves.
Thank you, Bob. So we've got a whole series of questions on how the operating rules and certification would apply to the dental industry. Would Gwen or Bob want to kind of frame that for us? Or?
I'll take a quick stab at it initially. So dental has been involved in CORE. So CORE certification is the underlying standards and also the operating rules. Both of those are tested and then certified. There's several dental plans that are now CORE certified, and there's more in the pipeline. And then there's the vendors that support them. So some of the underlying standards and the operating rules absolutely directly apply to the dental industry. And then you'll see actually in the CAQH Index 2016 one that were put out, and it was based on about 5.4 billion claims that were submitted. We have a specific section just on dental. And dental adoption of these electronic transactions is a lot lower than medical. So take a look at that. And I know there's also some specific areas, like with prior authorization, where dental is handled differently. So we're continuing to look at that, just like we did with the CARCs and the RARCs. Pharmacy is handled differently for the claims denial. So we developed a alignment with NCPDP about how, when medical and pharmacy cross over for the claims denials, that we address that as an industry so it's not a hassle for the providers that may get claims that you're unclear, is it a dental, I mean, is it a pharmacy, is it a medical? And that's going to happen more and more, so that's going to be critical with dental also. And we are, again, looking at that index report and partnering with some of the dental associations to report out dental and get dental's input through those associations and their implementers. Bob, any other comments on that?
Just a couple of real add-ons there. Delta Dental of California and Integra, two large dental health plans on the West Coast, have completed phase 1 and 2 certification. So they've definitely seen the value in certification. We've also seen that it's been important that we do have test cases that are specific for dental verification for eligibility, as well as for, in phase 4, the dental claim. So dental plans, dental providers, dental clearinghouses can test for, and there are specific test cases for dental for many of the requirements of the core operating rules.
Thanks, Bob. So we're going to take one last question, and it's, is there a risk of a penalty for not being in compliance with the operating rules, and how does certification help with that? Bob, do you want to take that, or Gwen, would you like to start?
Bob, go ahead.
Yeah, great. There are definitely penalties set up by both HHS through HITECH as well as through HIPAA for not being in compliance with either the transactions or their associated operating rules. There are very specific penalties for health plans if they're not in compliance. There's kind of willful non-compliance. There's all kinds of shades of gray, but basically black and white, there are penalties associated for non-compliance with the operating rules, specifically for health plans with the ACA. So again, there's different laws covering different components of HIPAA, covering different stakeholder types, so it can be a little confusing, but there are no requirements under regulation or under law that health plans or providers or their clearinghouses or software vendors have to complete voluntary core certification. So I do want to make that very clear. Certification is completely voluntary. However, you do have to be in conformance and in compliance with the regulations for HIPAA to conduct the transactions when required to do so, and for the ACA to implement the operating rules and use the operating rules accordingly for phases 1, 2, and 3 for those transactions for eligibility, claim status, the EFT, and the ERA. So hopefully that clears up some of the murky grayness that can occur between the different types of laws and the regulations that are out and about.
Yeah, and I would just add 2 things to that. Thanks, Bob. That was a great overview of how HITRUST changed the HIPAA penalties too. With some entities are now actually requiring of its trading partners, so you should look to see if your trading partners are requiring voluntary core certification. And there were a few states, and I forget which one, because there was a lot of federal activity that also looked at, I think it was Ohio, and I'll have to remember the other state that looked at requiring core certification for their vendors and their health plans. So we'll probably see a lot more state activity as federal activity evolves over the next while.
Thank you, Gwen. And before we wrap it up, I also want to make a point. There were people asking about phase 4, and also for those of you asking your dental questions, we are working on webinars specific to phase 4. And also we want to have a webinar that sort of speaks to the dental community in particular, so stay tuned.
Great, thank you. And since we are out of time for today, I would like to thank our speakers and, of course, thank all of you in our audience for taking time out of your busy schedules to join us. And as a reminder, all registrants and attendees will receive an email with the presentation slides, as well as the webinar recording in the next 1 to 2 business days. So please keep in touch and enjoy the rest of your day. Thank you very much.